the vesicle-like storage container. VMAT can be inhibited by reserpine. Not important clinically, but it may come up on an exam. Just think of reserpine as this reserpent water snake blocking catecholamine catfish storage, thereby depleting your neurotransmitter stores. These are catch and release waters, after all, so on the vessel, let's sketch in one of the scouts displacing the catecholamine catfish and throwing them back into the water. This ichthyophile depicts the actions of amphetamines. His shirt says it all. Fish are a friend of mine, for amphetamine. Anyway, amphetamine is important chiefly because of its use and misuse as a CNS stimulant. These effects are mediated through the release of norepinephrine and, to some extent, dopamine. Methamphetamine is very similar to amphetamine, but with an even higher ratio of central to peripheral actions. The amphetamines have a mood-elevating effect, which is the basis for its widespread abuse. However, after entering the CNS, amphetamines also have an alerting, sleep-deferring action that is manifested by improved attention to repetitive tasks. So that's why they're perfect for treating narcolepsy and ADHD. ADHD will be again represented by the distracting television, this time on the boat. It looks like the scout here is so distracted that his bucket of catfish are falling right back into the lake. Who cares? The new hit reality show, Friend Date, is on. Let Friend Date remind you of methylphenidate and the rest of the related amphetamine stimulants used in ADHD. Have you heard of Friend Date? I mean, I don't watch it, but I heard that Braden was voted into the friend zone? I mean, I don't care, but let's just move on. Anyway, narcolepsy will be represented by this stuporous scout who couldn't care less about the mid-season finale and is hitting the snooze button on his alarm clock. Take a close look at the alarm clock and you'll see that it's in sleep mode. The word mode should remind you of the drug modafinil, a stimulant that's approved for treating narcolepsy, with fewer adverse effects compared to amphetamines. Think of modafinil as getting you out of sleep mode. Okay, one more thing about amphetamines and related stimulants. These drugs also have an appetite suppressant effect. While they're not used for the sole purpose of weight loss, appetite suppression can be a useful side effect in obese patients. So let's draw on this completely untouched plate of dinner sitting here on the coffee table. I'm pretty sure Friend Date and Snooze Button over here aren't interested. You know, with all this talk about dopamine and dopamine transport, let's finish up this sketch by briefly discussing the activation of dopamine receptors. Dopamine itself is an adrenergic agonist that has varying effects based on the dose administered. Let's depict these dopamine receptors here at the dope rope swing. See how the S and the I of the swing are highlighted? These are the G proteins coupled with D1 and D2 receptors, respectively. Because D1 receptors are coupled with GS, they cause increased CAMP. This leads to activation of protein kinase A and smooth muscle relaxation. So at lower doses, dopamine stimulates D1 receptors in the renal vasculature, thereby inducing and increasing GFR, renal blood flow, and sodium excretion. On an exam, the increase in renal blood flow may be the single distinguishing feature of dopamine, as other pressor agents such as epinephrine and norepinephrine cause alpha-1 constriction of most peripheral vasculature, including at the kidney. Let this single rope swing represent the D1 receptor, and notice that there's a kidney at the end of the renal vascular dope rope to represent the increased renal blood flow. The only other thing you need to know about IV dopamine is that it activates beta-1 receptors at low doses and alpha-1 receptors at high doses. Just think DBA. So after D1 and that increased renal blood flow, increase the dose and you'll reach this beta-1 bugler. Keep increasing it and you'll find an alpha-1 candle-wielding scout, a shining beacon at the top of the dope rope. So think of those beta-1 heart-activating effects and alpha-1 pressure effects, and you can understand why dopamine can be used as a pressor in heart failure or shock that is refractory to other agents such as norepinephrine. But on the exam, just remember which receptors are activated at different doses. By the way, we've got our D2 receptor here as well, represented by a double roped swing. It's a safer swing secured by 2 ropes. 2 ropes for D2. You know these scouts, though. Safety first. See this brain helmet? It's to remind you that D2 will be important when we discuss dopaminergic transmission in the CNS, affected by antipsychotics in Parkinson's therapy. But that's for later, so stay tuned. Well, it's that time again. Let's sum up this sketch. Indirect sympathomimetics enhance the actions of endogenous catecholamines either by displacing them from the nerve ending or inhibiting their reuptake or metabolism. In adrenergic neurons, catecholamines are synthesized endogenously from tyrosine. Tyrosine is converted into dopamine, a step that can be inhibited by the tyrosine analog metyrosine. Dopamine and other monoamines are transported into the vesicle by VMAT, which can be blocked by the reserpine serpent. Dopamine is converted to norepinephrine in the vesicle. After neurotransmitter release, synaptic transmission is discontinued by diffusion or reuptake. NET and DAT are transporters on the presynaptic membrane that bring norepinephrine and dopamine back into the cytoplasm. Cocaine inhibits NET and DAT, causing both peripheral sympathetic stimulation and CNS effects. Remember those classic signs of cocaine intoxication, including agitation, hypertension, dilated pupils, mucosal atrophy, and chest pain due to vasoconstriction. And also remember, don't block that beta. Our amphetamine fish friend works by displacing stored catecholamines. After entering the CNS, amphetamines have an alerting, sleep-deferring action, and so they've been used to treat narcolepsy and ADHD. At our ADHD TV, methylphenidate is represented by the hit show Friend Date, while our narcoleptic scout hits the snooze button. Modafinil is an amphetamine substitute approved for narcolepsy. Think of modafinil as getting you out of sleep mode,